Welcome to Chapter 7, Principles of Effective Communication. What is communication? That's a good question. So it's the activity of conveying information. So we may need to do that with patients, our partner, other EMS personnel, hospital personnel, fire personnel, law enforcement officers, bystanders, family, members of the patient, and friends of the patient. So emergencies are stressful. Once you've been doing this a while, it gets less stressful for you, but just remember that this may be the first emergency for the patient, or it could be, very emergent to them, even if it seems minor to you. So how you talk to them leaves a big impression, not only on yourself, but on the whole department and the entire, EMS and fire family. So how can the way we communicate information on a scene affect family members, bystanders, other responders? Well, we could either escalate the situation, make them less calm, or we can help calm them down. So we've got different types of communication: verbal, which is basically just what we see or what we say; nonverbal, body language, eye contact, and gestures; written, which is, our documentation, things like that; and then visual, signs, symbols, and designs. So the communication process: the sender, that's the person who's sending the communications, expressing a new thought. The message itself is the thought, the concept, or the idea, and then the receiver is the person who the message was intended for. So transmitting messages, 55% of it is body language: gestures, expressions, posture, and physical manifestations. 38% is your voice, which is your tone, inflections, and quality, and then only 7% is the words you used. So body language plays a huge part in it, as so does voice. There can be many barriers: physical, perceptual, emotional, cultural, language, gender, and interpersonal. So make sure you're speaking clearly, use words and terminology that the person will understand, keep an open mind, and resist the urge to be defensive. Be an active listener, be assertive, especially when safety is at stake. Remain aware of the influence of your body language. Remember, it's 55%. And accept the reality that sometimes there's going to be miscommunication. So interpersonal communication is an important form of verbal communication. It's most often done between 3 or fewer participants that are close together. And good interpersonal communication, the feedback between the sender and the receiver is immediate. And you have therapeutic communication, which is face-to-face, focuses on advancing physical and emotional well-being of a patient, and the key component is trust. There's 3 objectives to therapeutic communication: collecting information, assessing behavior, and educating. So when we're interviewing our patients, always introduce yourself and the level of your training. Hi, my name's Ian, I'm a paramedic. What's your name? Get their name early, use it frequently during the interview. Position yourself at or below patient's eye level whenever possible. I might be old-fashioned, but I always refer to them as sir or ma'am. I avoid things like sweetheart, honey, man, dude, things like that. So I always introduce myself. Hi, my name's Ian. I'm a paramedic. Can I help you today? Can you tell me your last name? Could you spell that for my partner? Can you tell me your first name? Could you spell that for my partner? Okay, sir or ma'am. Can you tell me when your birthday is? Make sure you're kind of at their eye level whenever possible. If they're sitting, kind of squat down. Ask one question at a time. I even find myself doing that, where you want to get on to the next question. Meds, allergies, things like that. But make sure you give them time to answer. Listen carefully to everything they tell you, and if you need clarification, go ahead and repeat it to them. Be careful with this though, because you don't want to let them ramble. Some patients like to ramble. Notice what works and what does not work. For me, I notice a lot that when you ask a patient if they have medical problems, a lot of times they'll say no, and then you ask them, do you take any medications? And they say, yeah, here's a list. Well, to them, it's not a medical problem because they're treated for it. So I always like to start with, do you take medications? And when they say yes, I say, oh, can you tell me what they are? And then if they tell me, they say lisinopril, I know, okay, so, oh, so you have a high blood pressure issue? If it's a medication I don't recognize, go ahead and ask them. I always just say, oh, what do you take that for? And that's a great way to get medical history. So just notice what works for you and what doesn't. And of course, it could change based on how old the patient is. And then cultural considerations. We don't need to worry about this so much in the Mountain Green area, but we can run into it. So be very respectful of different cultures and beliefs. Use translation services if possible. Believe it or not, talking slower and louder doesn't mean that someone that doesn't speak English can understand English all of a sudden. So call dispatch, see if they can get a translator on the line for you. Patients with disabilities, some people may have hearing loss. Don't just assume, though, an elderly patient is hard of hearing and go in and start talking really loud. They may have cognitive disabilities, but don't just assume they have cognitive disabilities. And some of them may have service animals. Transfer of care. So physical and verbal handing off of care from one healthcare provider to another. So this would be like us handing off care to Morgan Ambulance, or if we ride to the hospital with them, handing off care to the hospital staff. We want to give them the patient's name and age. Hey, this is so-and-so. She's a 28-year-old female complaining of chest pain. Give them a brief account of the current condition. And it started about 20 minutes ago. She was mowing the lawn. She does have a history of angina, which is, just chest pain, chronic chest pain. And just kind of give them a quick rundown of what's going on. Give them their vital signs. Hey, these are the vitals we got. Any pertinent findings from the physical exam. Overview of care provided. Hey, this is what we've done so far. We've given her aspirin, or we've put her on oxygen. And then if there's any changes, the patient said she could breathe better after we put her on the oxygen. That's important information too. Radio communications. So a radio system is a combination of transmitters, receivers, repeaters, and antenna. Dispatch centers utilize base station radios that transmit over a wide area, and EMS personnel carry pagers and handheld portable radios. You notice, let's talk about that real quick. It says portable radios. So if you ever have a test question that asks about types of radios, portable radios are the ones that we carry. Those little handheld ones with the lapel mic, that's a portable radio. A mobile radio is the one mounted in the squad, mounted in the engine. So that's the difference between portable and mobile. Pagers notify response personnel of emergency call. Portable radios communicate directly with the dispatch center. And radios require specific protocol when communicating with others in the system. So that's something that comes into play later on. We learn more about how to talk on the radio and things like that. That's it for this chapter. So again, if you have any questions, concerns, email me, call me, text me. I'm happy to help. Hopefully these are useful to you guys, and I'll see you at the next one.